Have you ever walked out of a doctor's appointment feeling like you weren't really heard, like your concerns were brushed aside simply because of your age? You're sitting in that sterile examination room, trying to explain the pain that's been keeping you awake at night, the fatigue that wasn't there 6 months ago, or the memory lapses that genuinely frighten you. But instead of genuine attention, you get a patronizing smile and hear those devastating words. Well, at your age, this is perfectly normal. Your heart sinks because deep down, you know something isn't right, yet you're made to feel like you're overreacting or wasting everyone's time. What I'm about to share with you isn't easy to hear, but it's a truth that millions of seniors face every single day in doctors' offices across America. There's a hidden epidemic of medical ageism that's literally costing lives and stealing years of quality living from people who deserve so much better. Behind closed doors, many healthcare providers harbor unconscious biases that affect how they diagnose, treat, and even listen to older patients. These aren't isolated incidents or bad apples. This is systemic discrimination disguised as medical care, and it's happening to people just like you and me. In the next few minutes, I'm going to reveal 5 ugly truths about what really goes on in the minds of some doctors when they treat seniors. Truths that the medical establishment doesn't want you to know. But more importantly, I'm going to show you exactly how to recognize these patterns, protect yourself, and demand the respectful, thorough care you deserve. Because once you understand what's really happening, you'll never let another doctor dismiss your concerns again. Number 1. Age-based assumptions and diagnostic shortcuts. Picture this. You walk into a doctor's office, and before you even sit down, before you say a single word about what's bothering you, the doctor has already made up their mind about you. They see your gray hair, notice your slower walk, and instantly categorize you as complicated, time-consuming, difficult. It's like being judged by the cover of a book that no one bothers to open. This is the harsh reality millions of seniors face every single day. The moment healthcare providers see your age on that chart, mental shortcuts kick in. They're trained to be efficient, to move quickly through patients, and unfortunately, older adults get labeled as the ones who will slow everything down. The system rewards speed over thoroughness, and guess who pays the price? You do. Here's what's really happening behind those closed doors. Doctors are making assumptions before they even examine you. They're thinking about how much time you'll take, how many complaints you might have, how complex your case could become. It's called complexity aversion, and it's stealing your right to proper health care. Instead of diving deep to find what's really wrong, they're taking shortcuts, giving you generic treatments, missing critical diagnoses that could change your life. Take Maxine, a vibrant 68-year-old who went to her doctor complaining of chest pain and fatigue. Instead of running the same tests they'd run on a 40-year-old, her symptoms were quickly dismissed as anxiety and normal aging. 3 weeks later, she had a heart attack. A proper cardiac workup could have prevented that. Her age became a barrier to the care she deserved. But here's what you can do to fight back. Walk into every appointment with a clear, written summary of your symptoms. Be specific about when they started, how they've changed, what makes them better or worse. Don't let anyone rush you through your story. You have every right to be heard completely. If a doctor seems to be making assumptions, stop them and ask directly, "Would you run these same tests if I were 45 years old?" That question changes everything. Your age is not a disease, and your symptoms deserve the same thorough investigation as anyone else's. Because behind every shortcut lies a missed opportunity to help you live your best life. Number 2, medical gaslighting and symptom dismissal. How many times have you heard those soul-crushing words? Well, at your age, this is perfectly normal. You're sitting there, knowing in your heart that something has changed. Something is wrong, but the person you've trusted with your health is telling you it's all in your head or just part of getting older. This is medical gaslighting, and it's epidemic in how healthcare treats seniors. Your legitimate concerns, your real pain, your genuine fears about changes in your body are being dismissed with a wave of the hand and a patronizing smile. It's not just frustrating, it's dangerous. When doctors default to "it's just aging," they're taking a medical shortcut that can cost you years of good health, or worse. Dr. Michael Tours, a geriatric specialist, calls this approach a medical cop-out. He's seen the devastating results when serious conditions are brushed off as normal aging. The American Geriatric Society found something shocking. 85% of serious health conditions in seniors are initially misdiagnosed as simple aging symptoms. 85%. That means the vast majority of real, treatable problems are being ignored because of age bias. But here's the deeper damage this causes. When your concerns are repeatedly dismissed, you start to doubt yourself. You begin to question whether that pain is real, whether that memory lapse matters, whether you're just being dramatic. This self-doubt creates a vicious cycle. You stop reporting symptoms, you delay seeking help, and by the time you can't ignore the problem anymore, it's often much worse than it needed to be. The psychological toll is enormous. You're not just losing trust in your healthcare providers, you're losing trust in your own body, your own perceptions, your own right to advocate for yourself. This learned helplessness becomes a prison that keeps you from getting the care you need and deserve. Here's how to break this cycle. Start documenting everything. Keep a simple health journal noting when symptoms occur, how severe they are, what triggers them. When a doctor dismisses your concerns, ask them to document in your medical record exactly why they believe your symptoms are due to normal aging. Most won't want to put dismissive assumptions in writing. Demand specific explanations, not general brush-offs. Remember this: your body is sending you signals for a reason, and those signals deserve respect, investigation, and proper medical attention, regardless of what year you were born. Number 3. Real-life cases of discriminatory healthcare. Let me tell you about Carl, a 72-year-old retired mechanic whose hands had been his livelihood for 5 decades. When those same hands started swelling and causing him excruciating pain, he knew something was seriously wrong. But doctor after doctor told him it was just arthritis, just wear and tear from all those years of hard work. Take some ibuprofen, they said. This is what happens when you get older. Carl lived with that dismissive diagnosis for 2 agonizing years. His hands became so painful he couldn't hold his coffee cup, couldn't hug his grandchildren without wincing. It wasn't until he demanded specific blood tests, refusing to leave the office until they were ordered, that the truth emerged. Severe rheumatoid arthritis, a completely treatable autoimmune condition. With proper medication, Carl got his life back within months. But think about those 2 years of unnecessary suffering. Then there's Louise, a retired college professor with a PhD in literature. When she was diagnosed with breast cancer at 71, her oncologist immediately started talking about age-appropriate treatments. Less aggressive chemotherapy, shorter treatment courses, palliative rather than curative approaches. Louise had to fight for every standard treatment protocol, had to prove she was strong enough, smart enough, worthy enough for the same care a 50-year-old would receive automatically. But perhaps the most heartbreaking story is Walter's. When his kidneys began failing at age 75, he was told he was too old for dialysis. The nephrologist explained that at his age, the treatment would be too taxing, that he should focus on comfort care. Walter refused to accept that death sentence. For 3 months, he advocated, he researched. He brought his daughter to appointments to fight alongside him. Finally, a different doctor agreed to start dialysis. Walter didn't just survive those treatments, he thrived. He returned to teaching Sunday school, walked his youngest granddaughter down the aisle at her wedding, and lived 7 more productive, joyful years. 7 years that he almost lost because someone decided his age made his life less valuable. These aren't isolated incidents. They represent a systematic problem where age becomes the primary factor in medical decision-making, overshadowing everything else about who you are, what you want, and what you're capable of handling. Here's what you need to do. Never accept age as the sole explanation for a medical decision. Ask for specific clinical criteria, demand to know what standards are being used, and always ask, "If I were 45, would you recommend the same approach?" Document everything. Bring an advocate to important appointments, and remember that persistence saved Carl, Louise, and Walter's lives. Your age is just one piece of your story, not the entire book, and you have every right to write the chapters that follow. Number 4. Cognitive stereotypes and oversimplified communication. Imagine walking into your doctor's office and being spoken to like you're a child. The physician talks slower, uses simpler words, explains things in elementary terms, all because they've glanced at your birth date and assumed your brain has somehow shrunk along with your patients for being treated with dignity. This happens every single day in healthcare settings across America. Doctors, nurses, and staff make automatic assumptions about your cognitive abilities based purely on your age. They dumb down explanations, limit treatment options, and make decisions for you instead of with you, all under the misguided belief that older adults can't handle complex medical information or make sophisticated healthcare decisions. Here's the insulting reality. A retired engineer who designed bridges is told his heart medication options in terms a fifth grader could understand. A former CEO who managed billion-dollar budgets is given a pill organizer and a patronizing lecture about keeping things simple. A retired teacher who spent decades educating young minds is handed a pamphlet with cartoon pictures instead of detailed treatment information. This cognitive stereotyping doesn't just hurt your feelings, it hurts your health. When healthcare providers assume you can't handle complex treatment regimens, they prescribe suboptimal medications with simple dosing schedules instead of the most effective treatments available. When they assume you won't understand surgical options, they don't fully inform you of all possibilities. When they assume you can't manage your own care, they create dependency instead of empowering you to take control of your health. The most damaging part is how this affects medication management. Doctors often prescribe older, less effective drugs because they have simpler dosing schedules, assuming you can't handle taking medication twice a day instead of once. They skip explaining side effects, drug interactions, or what to watch for, leaving you uninformed about your own treatment. This doesn't protect you, it endangers you. Louise, that retired professor I mentioned earlier, experienced this firsthand. During her cancer treatment, nurses would explain chemotherapy side effects using simple terms and avoiding medical language, until Louise stopped them and said, "I have a doctorate. I can handle the real terminology and want to understand exactly what's happening to my body." Suddenly, the quality of communication changed dramatically, and Louise became a true partner in her care instead of a passive recipient. Here's how to combat this disrespect. Establish your credibility immediately. Mention your educational background, your professional experience, your current activities. Ask for detailed explanations using proper medical terms. Request written information at an appropriate reading level. If someone talks down to you, stop them politely but firmly and say, "I'd prefer you speak to me the same way you'd speak to any other adult." Your mind is not a relic from the past. It's a powerful tool in the present, and you have every right to use it fully in managing your healthcare and your future. Number 5. Digital discrimination and technological exclusion. They hand you a card with a website address and tell you to check your test results online. But then they look at your gray hair and automatically assume you don't know how to use a computer. Or worse, they don't even offer you access to patient portals, online scheduling, or digital health tools because they've decided you're too old to navigate technology. This digital discrimination is creating a two-tiered healthcare system where younger patients get convenience, access, and control, while older adults are left behind, treated as technological dinosaurs who need everything done for them. It's not just insulting, it's isolating you from your own medical care. Here's what's really happening. Many healthcare systems now put critical information online, from test results to appointment scheduling to medication refill requests. But instead of teaching you how to use these tools or ensuring you have access, many providers simply exclude older patients from digital options entirely. They make assumptions about your comfort level with technology, your willingness to learn, or your ability to adapt to new systems. The consequences go far beyond inconvenience. When you can't access your own medical records online, you can't track trends in your health numbers, can't easily share information with specialists, can't take an active role in monitoring your own care. When you can't communicate with your healthcare team through patient portals, you're forced to play phone tag or wait for appointments for simple questions that could be answered quickly online. But here's the cruel irony. Many of you are far more tech-savvy than healthcare providers assume. You're on social media, you shop online, you video chat with grandchildren across the country. Yet medical offices continue to treat you like you've never seen a computer screen. Even worse, when you do express interest in using digital tools, staff often discourage you, saying it's too complicated or not worth the trouble. They're essentially telling you that staying connected to your own healthcare isn't worth your time or effort. This creates learned helplessness, where you begin to believe you really can't handle these systems, even though the real problem is inadequate support and training. Margaret, a 69-year-old retired librarian, was told by her doctor's office that the patient portal probably wasn't for her. Margaret had been helping people navigate computer systems for years before retiring. She insisted on getting access, learned the system in one afternoon, and now manages all her healthcare communications digitally. She gets faster responses, better record keeping, and feels more in control of her care than ever before. Here's how to fight digital discrimination. Insist on equal access to all digital tools and services. Don't let anyone assume you can't or don't want to use technology. Ask for training if you need it, but demand the same opportunities as any other patient. If staff discourage your digital participation, ask to speak with a supervisor and explain that you want full access to your healthcare information and communication tools. Technology should be empowering you to take greater control of your healthcare, not creating barriers that keep you from the care and information that's rightfully yours. Number 6. Misuse of medication for behavioral control. Beverly was a fighter her whole life. She raised 5 children as a single mother, ran a successful small business, and never backed down from a challenge. So when her hip surgery didn't go as planned and she started asking tough questions about her recovery, the hospital staff had a solution. They didn't address her concerns, they sedated her into compliance. What happened to Beverly happens to thousands of seniors every day across American healthcare facilities. When older adults advocate for themselves, ask difficult questions, or refuse to quietly accept substandard care, they're not seen as engaged patients exercising their rights. They're labeled as difficult, agitated, or non-compliant, and the solution isn't better communication or addressing their concerns. The solution is pharmaceutical control. Here's the shocking truth. Over 40% of seniors in healthcare facilities are given psychiatric medications, sedatives, or mood stabilizers, but only 12% actually have formal psychiatric diagnoses that would justify these drugs. These medications aren't being prescribed for your mental health. They're being used to make you easier to manage, quieter, more compliant, less likely to cause what staff consider trouble. Think about what this really means. Your legitimate concerns about your care, your reasonable questions about treatment options, your natural anxiety about your health. These normal human responses are being chemically suppressed not for your benefit, but for the convenience of others. You're being drugged into submission when what you really need is to be heard, respected, and properly treated. The consequences are devastating. These unnecessary medications cause dangerous side effects, increased fall risk, cognitive decline, depression, and dependency. Beverly fell twice while over-medicated, broke her wrist, and developed cognitive fog that lasted months after the drugs were discontinued. These weren't side effects of treating a mental health condition. These were the predictable results of using powerful psychiatric drugs for behavioral control. Families often unknowingly participate in this abuse. Healthcare staff subtly suggest that sedating medications will help their loved one rest better or be more comfortable, without explaining that comfort could mean chemical restraint. Family members, wanting the best for their older relatives, agree to medications they don't fully understand for conditions that don't actually exist. The institutional motivations are clear. Sedated patients require less staff time, generate fewer complaints, and create fewer disruptions to routines. It's cheaper and easier to medicate someone into compliance than to address their legitimate concerns or improve the quality of care. But this isn't healthcare, it's chemical imprisonment. Here's how to protect yourself and your loved ones. Always ask for specific psychiatric diagnoses before accepting any mood-altering medications. Demand to know exactly why these drugs are necessary and what non-pharmaceutical alternatives exist. Keep a list of all medications and question any additions, especially sedatives or antipsychotics. Bring an advocate to medical appointments who can help ensure your voice is heard without pharmaceutical interference. Your right to speak up, ask questions, and advocate for your care is not a behavioral problem to be medicated away. It's a fundamental part of being an engaged, empowered patient who deserves respect and proper treatment. Number 7. Economic valuation of life and treatment denials. There's a cold calculation happening in healthcare boardrooms across America, and it's determining whether you're worth saving. It's called QALY, Quality Adjusted Life Years, and it assigns a dollar value to your remaining life based primarily on one factor: your age. Under this system, your life at 70 is considered worth less than the same life at 30, not because of your health, your vitality, or your potential for recovery, but simply because of the number of years you might have left. This isn't theoretical economics. This is real policy affecting real people every single day. Insurance companies and healthcare systems use these calculations to deny you access to expensive treatments, advanced procedures, and life-saving interventions that would be approved without question for younger patients. Your chronological age becomes the primary factor in determining whether you deserve a chance to live. Consider what this means in practical terms. A 68-year-old needing a liver transplant might be denied not because they're not healthy enough for surgery, not because they wouldn't benefit from the treatment, but because the system calculates that those organs would provide more life years if given to someone younger. A 72-year-old diagnosed with cancer might be steered toward palliative care instead of aggressive treatment, not based on their individual prognosis, but on actuarial tables that suggest their remaining years aren't worth the investment. This economic discrimination extends to mental health care, where depression and anxiety in older adults are routinely dismissed as normal parts of aging, rather than treated as the serious, debilitating conditions they actually are. Insurance coverage for therapy, psychiatric medications, and mental health services often becomes more restrictive as you age, as if your emotional well-being matters less because you're older. The system particularly fails older women, who face double discrimination based on both age and gender. Studies show that older women are more likely to have their symptoms dismissed, less likely to receive aggressive treatment for heart disease, and more likely to be prescribed sedatives instead of receiving proper psychiatric care for depression and anxiety. James, a 73-year-old retired teacher, was denied coverage for an innovative cardiac procedure that could have given him years of active life. The insurance company's justification was purely economic. The cost per life year saved was too high for someone his age. James paid for the procedure himself, recovered fully, and spent the next 8 years traveling with his wife, volunteering at literacy programs and mentoring young teachers. 8 years of meaningful life that the system deemed not worth funding. Here's how to fight economic discrimination in your healthcare. Always ask if age is a factor in any treatment recommendation or denial. Demand to know what criteria are being used and whether the same standards would apply to a younger person. Request appeals in writing and ask for specific medical reasons, not economic ones, for any treatment denials. Seek second opinions from geriatric specialists who understand that your age doesn't diminish your right to appropriate care. Your value as a human being isn't determined by actuarial tables or cost-benefit analyses, and your right to healthcare shouldn't decrease just because you've lived long enough to accumulate wisdom, experience, and the perspective that comes with age. Number 8, emergency room and family-based ageism. When you arrive at an emergency room with chest pain at age 70, you're 3 times more likely to be discharged quickly with minimal testing than if you were 40 with identical symptoms. This isn't because your symptoms are less serious or because you're less likely to have a heart attack. It's because emergency room staff, consciously or unconsciously, make different assumptions about older patients from the moment you walk through those doors. The statistics are chilling. Seniors receive fewer diagnostic tests, shorter examination times, and faster discharges than younger patients presenting with similar symptoms. ER staff admit in anonymous surveys that they make different decisions based on age, often assuming that aggressive treatment won't significantly change outcomes for older patients. They're making life and death decisions based on stereotypes rather than medical evidence. But the discrimination doesn't stop with medical staff. Often, your own family members are subtly guided toward choosing less aggressive care for you, not because it's medically appropriate, but because it's less expensive and supposedly more age-appropriate. Healthcare providers frame inferior treatment options as compassionate choices, suggesting that intensive care or advanced procedures might be too much for someone your age. Alina arrived at the emergency room with stroke symptoms. At 74, she was alert, articulate, and lived independently. But instead of receiving the same rapid stroke protocol that would be automatic for a younger patient, staff focused on comfort measures and encouraged her family to consider palliative care. Alina's daughter, a nurse herself, had to fight for hours to get her mother the clot-dissolving treatment she needed. Alina recovered completely, but only because her family refused to accept age-based assumptions about her care. This family-based ageism is particularly insidious because it comes wrapped in concern and love. Families are told they're being realistic, compassionate, and wise to choose less aggressive treatments for their older relatives. They're not told that these same gentle approaches would never be suggested for younger patients with identical conditions. They're not told that age alone is a poor predictor of treatment success or quality of life after recovery. The emergency room environment, with its chaos and time pressure, amplifies these biases. Staff make quick decisions based on first impressions, and unfortunately, advanced age often leads to assumptions about frailty, cognitive decline, and limited life expectancy, even when those assumptions are completely wrong. Your gray hair becomes more influential in treatment decisions than your actual health status, cognitive function, or personal wishes. Healthcare providers also use euphemistic language that disguises discriminatory practices. They talk about age-appropriate care instead of lesser care, about realistic expectations instead of lowered standards, about comfort-focused treatment instead of giving up. This language makes families feel like they're making compassionate choices when they might actually be accepting substandard care based on ageist assumptions. Here's how to protect yourself in emergency situations. Always bring a strong advocate who knows your wishes and won't be intimidated by medical staff. Create an advance directive that specifically states your desire for aggressive, life-sustaining treatment regardless of your age. Teach your family members to ask, would you recommend this same approach if the patient were 45? Document any age-based treatment recommendations and ask for them to be put in writing with medical justifications. In medical emergencies, your age should inform care decisions only in combination with your overall health, your personal wishes, and your potential for recovery, not as the primary factor that determines whether you're worth saving. Number 9. Counteracting medical age bias. The good news is that you're not powerless against medical ageism. Every time you walk into a healthcare setting, you have tools and strategies that can completely change how you're treated, how you're perceived, and how your care is managed. The key is knowing how to use them effectively and having the confidence to demand the respect you deserve. Start every medical appointment by taking control of the narrative. Instead of letting the healthcare provider make assumptions based on your appearance, immediately establish who you are beyond your age. Mention your current activities, your professional background, your goals for your health. Say something like, I'm here because I want to continue hiking with my grandchildren, or I need to address this issue so I can keep volunteering at the literacy center. This immediately frames you as an active, engaged person with a future worth protecting, not someone who's just marking time. Come prepared with specific, organized information. Bring a concise timeline of your symptoms, noting when they started, what makes them better or worse, and how they're affecting your daily life. This shows you're an engaged, informed patient who takes your health seriously. It prevents healthcare providers from dismissing you as confused or unable to provide reliable information about your own body. Here's the most powerful question you can ask. Would you recommend this same treatment approach if I were 45 years old? This question cuts through age bias like nothing else. It forces healthcare providers to examine whether their recommendations are based on medical evidence or age-related assumptions. Most providers won't want to admit they're making age-based decisions, so this question often leads to more thorough evaluations and better treatment options. Document everything. Keep notes about what was discussed, what tests were recommended or declined, and what the reasoning was for treatment decisions. If a provider says something is normal for your age or suggests less aggressive treatment because of your age, write it down and ask them to document it in your medical record. Most providers won't want to put ageist assumptions in official documentation. Demand specific medical criteria for all treatment decisions. When someone suggests you're too old for a particular treatment or procedure, ask exactly what clinical factors make you unsuitable. Ask to see the research or guidelines that support age-based exclusions. Often, you'll find that age limits are institutional policies rather than medical necessities, and policies can be challenged and changed. Bring an advocate to important appointments. This doesn't mean bringing someone to speak for you. It means bringing someone who can help ensure your voice is heard and your concerns are addressed. An advocate can ask follow-up questions you might forget, can help you process complex information, and can witness interactions that might otherwise be dismissed or misremembered. Don't accept dismissive responses. If someone brushes off your concerns with "it's just aging," push back firmly but politely. Say something like, I understand that some changes come with age, but I know my body and something has changed. I'd like you to help me understand exactly what might be causing this change and what we can do about it. Remember that persistence pays off. Carl got his rheumatoid arthritis diagnosis, Louise got her full cancer treatment. Walter got his life-saving dialysis, all because they refused to accept age-based limitations on their care. Your persistence not only improves your own health care, it helps change the system for other seniors who come after you. You have more power than you realize, and every time you use it, you're not just advocating for yourself, you're helping to dismantle a system of discrimination that has gone unchallenged for far too long. Number 10. Advocacy, legal rights, and systemic change. You have legal rights in healthcare that don't disappear when you turn 65, and it's time to start using them. Age discrimination in healthcare violates federal law, and there are specific resources, specialists, and advocacy organizations designed to help you fight back when you encounter bias in medical settings. Geriatricians are your secret weapons in this fight. These are doctors who specialize in caring for older adults and understand that aging itself is not a disease. They know the difference between normal age-related changes and serious medical conditions. They're trained to avoid the shortcuts and assumptions that plague general health care. If you're dealing with multiple health issues or feel like your concerns aren't being taken seriously, finding a good geriatrician can transform your healthcare experience. There are also advocacy organizations specifically designed to combat healthcare discrimination against seniors. The National Committee to Preserve Social Security and Medicare, AARP, and local area agencies on aging all have resources to help you navigate healthcare discrimination. They can provide guidance on filing complaints, finding appropriate specialists, and understanding your rights as an older patient. When discrimination occurs, document it thoroughly and report it. Healthcare facilities are required to have patient advocacy programs, and insurance companies have appeals processes specifically for challenging age-based treatment denials. The Centers for Medicare and Medicaid Services takes complaints about age discrimination seriously, especially when they involve providers who receive federal funding. But perhaps the most important change happens when you realize that every time you successfully challenge age-based assumptions, you're creating ripple effects that benefit other seniors. Beverly, who fought against being unnecessarily sedated, didn't just improve her own care. Her complaints led to a review of medication protocols at her hospital that changed practices for hundreds of other patients. Walter's fight for dialysis access led to policy changes that made it easier for other seniors to receive life-saving treatments. These individual acts of resistance add up to systemic change. When healthcare providers encounter seniors who are informed, assertive, and unwilling to accept age-based limitations, it forces them to examine their own biases and practices. It makes them think twice before making assumptions about the next older patient they see. Legal options exist when other approaches fail. The Age Discrimination Act prohibits healthcare providers who receive federal funding from discriminating based on age. If you can prove that you were denied appropriate care primarily because of your age, you may have grounds for legal action. Elder law attorneys specialize in these cases and often work on contingency, meaning you don't pay unless they win your case. Support networks are crucial in this fight. Connect with other seniors who have successfully advocated for better healthcare. Share information about healthcare providers who treat older adults with respect and competence. Create informal networks that can provide emotional support and practical advice when you're facing medical discrimination. Education is also a powerful tool. Many healthcare providers aren't intentionally discriminatory. They're simply operating on unconscious biases and outdated assumptions about aging. When you educate them about your capabilities, your goals, and your expectations, you're helping them become better healthcare providers for all their older patients. The ultimate goal isn't just better healthcare for you individually. It's changing a healthcare system that has systematically undervalued and underserved older adults. Every time you insist on being treated with dignity, Every time you demand appropriate care, every time you refuse to accept age as a limitation, you're participating in a quiet revolution that's reshaping how America treats its older citizens. Your voice matters, your health matters, and your insistence on being treated as a whole person, rather than just a collection of age-related problems, is helping to create a healthcare system that serves all patients with the respect and quality care they deserve, regardless of when they were born. The truth we've shared today isn't easy to face, but it's one you needed to hear. For too long, the healthcare system has operated on the assumption that your age defines your worth, your potential, and your right to quality care. But now you know better. You know that behind every dismissive comment, every rushed appointment, every time someone tells you it's just aging, there's often a bias that has nothing to do with your actual health needs. Remember Carl, who fought for 2 years to get proper treatment for his rheumatoid arthritis. Remember Louise, who had to prove she deserved the same cancer care as someone half her age. Remember Walter, who was told he was too old for dialysis and then lived 7 more meaningful years because he refused to accept that verdict. These aren't just stories. They're proof that when you stand up for yourself, when you refuse to be dismissed, when you demand the respect you've always deserved, you can change not just your own experience, but the entire system. Your age is not a disease. Your concerns are not automatically invalid. Your life is not less valuable because you've lived more of it. Every time you walk into a medical appointment armed with the knowledge you've gained today, every time you ask that crucial question, would you recommend this same treatment if I were 45? Every time you refuse to let anyone talk down to you or brush off your symptoms, you're not just advocating for yourself. You're paving the way for every senior who comes after you. The tools are in your hands now. Document everything. Bring advocates. Demand explanations. Trust your instincts about your own body. Seek geriatricians who understand that caring for older adults requires expertise, not assumptions. Most importantly, never let anyone convince you that accepting inferior care is the wise or graceful thing to do. Which of these truths hit closest to home for you today? What experience have you had that makes this message so important to share with others who need to hear it? If this opened your eyes to something you needed to understand, please share it with someone else who deserves better health care. Your comments and experiences help others feel less alone in this fight. You've earned the right to demand respect in every aspect of your life, and healthcare is no exception. Your story isn't over, and neither is your power to write its next chapters.